Hi, good evening. My name is Dr. Ronak Patel. I'm a board-certified anesthesiologist with a subspecialty board certification in interventional pain medicine. Thanks for joining us this evening. A little bit about my background training. I did my internship in New York City and my residency in Gainesville at the University of Florida, and then my fellowship at the University of Kentucky in Lexington. My medical career started in academic medicine, where I was involved in research, taking care of pain patients and teaching medical students, followed by 10 years in private practice, where I was a medical director for Riverside Surgery Center. And then most recently as a pain management physician for the United States Navy. Working in such different environments has given me the opportunity to take care of patients with a variety of pain issues. In general, in my practice, I treat a variety of pain issues, whether it's acute or chronic, or pain that might be originating from the spine, such as the neck, which can cause shooting pain down the arms, or from pain from the low back, which can cause shooting pain or radicular pain down the legs. I also treat all major joints, such as shoulders, hips, SI joint, and knees. When formulating a treatment plan for my patients, I ask myself three questions. What can I do to decrease my patient's pain? What can I do to increase their function? And then most importantly, what can I do to improve their quality of life so they can continue enjoying things that matter the most to them? At Southeast Orthopedics, we offer a variety of treatment options for pain. We offer actually some of the most advanced treatment options for pain. And I wanted to kind of go over some of the big picture ones. For the spine, we do things called cervical epidural steroid injections, as well as thoracic and lumbar epidural steroid injections. A lot of times these are used to treat when there's a disc bulge or disc herniation, the nervous pinch. That's when you might be getting symptoms, either shooting down your arms or numbness in your arms, or shooting down your legs, or numbness in your legs. We also treat something called facet joints. There are hinge joints in your spine and your neck. Sometimes they can get irritated from a fall or a motor vehicle accident or some type of injury. We also do something called radio frequency nerve ablation, where we use heat to actually inactivate the nerve endings, and that can give you long-term relief, sometimes 6 months to a couple of years. We also do something called spinal cord stimulation, where we place electrodes in the epidural space. And what happens with that is the perception of pain changes. It's based on something called gate theory. So whenever you're hurting, your body sends signal to your spinal cord and then to your brain. These electrodes kind of change that mapping, so your sensation from pain becomes more of a pleasant sensation, or a different kind of sensation. We also do something called injections with either steroids or PRP in major joints. Some of the joints we treat include shoulders, hips, SI joint, as well as the knee. Majority of our procedures are targeted therapy, so the guesswork is taken out. We use either an ultrasound machine or a fluoroscopy machine to target the specific area that we're treating, as we can guide our needle or inject the medication in a very specific region to give you the maximum benefit. Again, Southeast Orthopedics offers some of the most advanced pain treatment options that are currently available in the market. If you guys have any questions, please let me know. I started off from being an anesthesiologist, and then I decided to do a fellowship in interventional pain medicine because I missed interacting with patients. Just to see times when we do procedures on these patients and see the significant improvement in their quality of life and getting them back to functioning is what kind of gets me up in the morning. All my procedures are performed by myself. In clinic, you'll see me when you come for a new patient evaluation or for a follow-up. And in the procedure room, you'll see myself as well. We do have other technicians who help us. Another technician called fluoroscope technician will take the x-ray from me. So while I'm doing the procedure, I can have a live real-time imaging for the procedure. For all the procedure performed by myself. For some patients, the relief is immediate because we inject a local anesthetic with the steroid. And then for some patients, it can take 3 to 4 days to start working. The example I give is like having poison ivy in your hand. If I rub steroid in the specific area, the inflammation will start going down. You may not notice it until the inflammation goes down to a certain period, and then you start noticing significant relief. So again, it can be a few hours to a couple of days before you start noticing significant relief. I'm currently going to the beach location, yes. I'm actually going right now to Fleming Island, to Riverside, South Side, North Side, and the beach. I'm covering most of the location that Southeast Orthopedics currently has available. I'm just there at different times of the week or different times there in the month. I would call the Southeast Orthopedics phone number, and the prompt will take you to make a new patient appointment. Well, thank you tonight for joining, and looking forward to meeting some of you in person.